Good afternoon, everybody. Myself, Dr. Sushil Lohiya. I'm a consultant laparoscopic and bariatric surgeon at KIMS-Kingsway Hospital, Nagpur. I welcome you on the behalf of KIMS-Kingsway Hospital. Today, we are going to discuss about new advances in medical and surgical management of your weight or weight loss. So, as we all know that nowadays obesity is also considered as a disease similar to your diabetes and hypertension. It is not just the high energy intake and less energy output or less active physical activity is the only reason for you gaining weight. The way our water intake is regulated in our body, the same way our body regulate weight by some hormonals and neurotransmitters. So there is a neuroendocrine axis which control the weight of our body. So let's regulate our metabolism or hormones which affects our basic metabolic rate. So what is basic metabolic rate is the energy that you spend when you are in a resting state. So our 70% of energy expenditure in a day is dependent on a basic metabolic rate. The activity that we actively do in a day is around 20%, and 10% of energy is spent on metabolizing the food that we eat. That's how our energy expenditure is made. And then how we eat, it also defines how much amount of weight we are going to gain. So, a person who is obese is considered when it is BMI. BMI is a basic metabolic index. It is calculated by our height and weight. If you calculate your weight in kgs and height in meter and divide weight by square of your height in meter, then the number that you get is your BMI. If it is in between 18 to 25, it is normal. If it is about 25, it is considered as overweight. If it is about 30, it is considered as obesity. In Asian population, if you are even about 27, you are more prone to diseases like diabetes, hypertension, sleep apnea, heart diseases. Then there is increased chances of paralysis, heart attacks, reflux, infertility, gout, osteoarthritis, few cancer like colon, ovary, and many other cancers. So obesity is directly related to all these diseases like diabetes, hypertension, and related comorbidity. So it is important to control weight if you want to keep all these diseases at bay. So what you have to do when you have to control weight, everybody try to control it by natural mechanism, by diet and exercise, and all of us do it for 3 to 6 months. Some extreme diets, some suggested by non-qualified or semi-qualified or qualified person, and then after 3 to 6 months, most of the people are not able to follow the extreme regime of diet or extreme regime of exercise. And whenever, as soon as they stop it, in a 6 month to a year's time, most of the people tends to gain their weight back. So that's where when you have tried diet and exercise, try modifying your lifestyle and not able to reduce your weight, then it is then yeah, medicine or surgery comes into the picture. So initially, the medicine was very weak for the weight loss. A lot of approved drugs, FDA approved drugs, were not available in India also. So 5% was the amount of weight that you could lose with medication that was era back. Now there have been recent advances in the medicine with the help of which you can reduce up to 10 to 15% of weight, and all metabolic problem like diabetes, hypertension, and other metabolic disorders like insulin resistance and other things, if they improve if you lose 15% of your excessive weight. So if you are able to reduce 15% of your excessive weight, the chances of your diabetic remission is very high. Diabetic remission becomes very high if you lose weight at the in the 4 year of onset of diabetes. It is up to 96% of the patient in India who are diagnosed with diabetes at the age of 4 years of onset of diabetes. So Sorry for the interruption. There was a error in internet at our end. So we were discussing about endoscopic option for the weight loss. So by endoscopic option, we reduces the space in your stomach. That makes your stomach feel full with a lesser amount of food, and that reduces your hunger and helps in the weight loss. It is by studies and statistics has shown that it can help you reduce 15 to 25% of your excess weight if we combine medicine and endoscopy both. You may reach up to 25% of the excessive weight loss, and which is very helpful for reversing your metabolic abnormality like diabetes and other diseases. So sometime if you want a more better control of your weight and the lesser recurrence of weight, and you don't want because some endoscopic options needs to be done at repeated interval. Even medicines which are for weight loss has to be taken for the life. And if you don't want to take medicine for the life or a repetitive endoscopic intervention, then there is an option of laparoscopic surgery where we put very small holes in your abdomen, around 4 to 5, and alter the gut anatomy in such a way that we reduces the size of stomach or create a malabsorption or bypass in the intestine, which is responsible for majority of fat absorption in your body. So if you bypass the initial part of the intestine which helps to absorb fat, then there is no excess fat to that intestine, and there is less absorption of fat. Not only the absorption and the diet or hunger or your satiety is altered, but also it affects your endocrine system, which makes your insulin more potent and decreases the appetite stimulating hormones like ghrelin, which reduces your hunger and increases your satiety. So this recreate a mechanism which is normally created by dieting and exercise, and then you lose your weight gradually over the period of 6 months to 2 years. And this is a gradual reduction of the weight, so it is a safer weight loss and is close to natural weight loss by diet and exercise, and helps you in the remission of diabetes, hypertension, lot of metabolic disorder, reduces your incidence of cardiac disease, neurological disease like strokes, paralysis, anti-acidity, increases the fertility, and lot of other help in other diseases like osteoarthritis, and many more. So the advantage of losing weight by whatever method, whether you are able to do it, the diet and exercise, whether you require medicine, whether you require endoscopy or a laparoscopy, is very helpful to reverse your chronic diseases. Nowadays, the losing weight is not just the cosmetic surgery or cosmetic option. If everybody wants to lose weight to remain fit, healthy, live long, as well as healthy. It is not just the quantity of life that is important, but also the quality of life is very important in the current era. In a current demanding times, we all need to be stay fit and active to be validate ourselves and to be in sync with the time and to perform well in with our peer and colleagues. So that is why it is important to employ whatever the methodology of weight loss that is safe for you, that is convenient for you, and you are ready to it. We have the scalable options, and most of the time people try to lose weight by some unscriptured people who are not qualified, and they try something which is very radical and very extreme, and which is not tested by data, science, and statistics, and they have some major side effects like osteoporosis. Then they have fractures. Some people have even have debilitating diseases, paralysis, because of nutritional deficiency that arise because of this kind of diets and exercise. So it is important, if you are taking diet and exercise, take it from a qualified person who has been done a right qualification, a MSc dietitian or registered dietitian who has adequate qualification and training to prescribe your diet. If you are doing exercise, do it under supervision of a trained physiotherapist or a qualified physical trainer who can help you to exercise without injuring yourself, because when you are overweight, you are more prone to sports injuries. Your body is taking a lot of load on the joints and ligaments and tendons, and that can lead to the lot of sports injury, and that is not healthy. So if you are doing anything, if you are overweight, then you should do it under supervision, as well as you have to evaluate yourself for the diseases that cause obesity or diseases that are caused by obesity and try to control it. It is always better to be under medical supervision when you are losing weight, because when you lose a significant amount of weight in a short period, and there are a lot of medical and metabolic changes in your body that needs to be monitored. Sometimes you may face high uric acid or some other problem in your body which need medical attention. So it is important to stay safe and do lose weight safely. A lot of advances in medicine, endoscopy, and surgery. There are so many newer surgeries which has come, which gives a very good metabolic result and long-term result. And most of these surgeries by data and statistics have been proven to be safe in the individual and have a very good long-term results. If you reverse your diabetes and hypertension for more than 8 to 10 years, it is very beneficial for your heart and brain and other organ of your body, and gives you a good life expectancy. Not only the quantity of life, but your quality of life has also changes after this treatment. So be stay informed, lose weight, live a healthy life. It is important to live healthy life. If whatever treatment you choose, eat mindfully, eat well, eat right food, and exercise in moderation. That is the key to weight loss. Thank you. So if you have any question, I am happy to answer that. So I have a question that how likely is that I will regain weight after surgery? So our body is a dynamic structure. It is not a static structure. Anybody can gain weight after surgery, but the amount of weight gain after surgery is not easy. It requires a lot of time. The average success rate of a surgery is almost more than 90%. And people, those who lose weight after bariatric surgery, most of the people don't gain weight in next 7 to 10 years. And those who gain weight also gain only 10 to 20% of their lost weight, which also significantly is a lesser weight than what they were before. So people generally lose to the tune of 50 to 70% of excessive weight after surgery. And if you gain 10 to 20%, you're still 50% excessive weight down from your benchmark weight. And when we often do surgery, when people are gaining weight, so if you consider a person who is gaining 10 to 15 kg every year and has undergone surgery as at the weight of 100 or 120 kg and has undergone surgery, has come back to 60 70 kg, and now he has gained 10 or 15 kg weight. Now he's at weighing 80 85 kg, and he is still a lot lower than what he was before. And if he has not undergone surgery at that time, then he might be around 130 140 150 kg. So if you consider both this figure, the people are still better off after surgery. And it is not just the weight gain, it is the duration also. If you are diabetic, if you have hypertension, if your disease of diabetes is under control for 10 years without any medical treatment or with minimal medical treatment, that is a big achievement from medical sciences. And that was your primary goal, to keep the diseases away, not just the weight is just the number. And even after surgery, we recommend you to at least walk 30 to 45 minutes 5 days a week, and choose right food. That is the key of the success, long term success after any kind of treatment. So there are a lot of benefit and risk associated with the surgery. The surgeries have to be chosen carefully. There are predominantly two kind of surgeries. One is restrictive surgery, where we restrict the volume of the stomach, and the another is the malabsorptive surgery, where we bypass the part of the intestine which absorbs fat. The part of the intestine which absorbs fat also absorbs some protein and nutrient like vitamin, minerals. So it is very important after surgery for you to take your multivitamin and calcium at regular intervals, sometime iron also, and under monitoring for nutritional deficiency. So if you take your multivitamins regularly and eat right amount of protein, there is no major disadvantage of surgery. You can live a healthy life for long. But if you skip your supplementation, then you may develop nutritional deficiency, especially if you have undergone malabsorptive surgeries or major malabsorptive surgery. So that's why it is recommended not to skip your nutritional supplements. And if you're taking it, there is no major side effects of the surgery. And the benefit, as I say, your diabetes undergo remission, hypertension undergo remission, cardiac disease, chances of strokes, heart attacks, they all reduce to normal. Your osteoarthritis improve, and the life of your natural and original native knee and other joints also improve. And the, of course, you reduces the chances of cancer associated with obesity and many more diseases. A lot of time people also improves on their fertility, which is because of obesity their fertility is reduced, it also improves. It's a very important and good question, that how much weight I will reduce after surgery and how is life after weight loss surgery. So the amount of weight that people reduce is variable. It varies from 40 to 50% on the lower side of excessive weight to 70 to 80% of excessive weight. That is a higher limit that you lose after surgery. Very rarely patient become underweight after surgery. It happens only when the people are undergone very severe malabsorptive surgeries, which are done with very much caution by all the surgeons, and people are not eating enough protein, then that may happen that patient develop underweight. Otherwise, most of the patient don't go to the weight not lesser than their normal weight. And the life after surgery is definitely, it has to be a disciplined life, because your size of the stomach is reduced. You have to eat at a regular interval of 2 hours. It may not be a full meal. You can have carry a small 3 or 4 or 5 almonds in your pocket, some chanas, peanuts, or small snacks in your pocket, or a pill pouch, and you can have at regular interval. You can drink buttermilk and that kind of high protein stuff in between, and that will help you to gain your nutritional need and not gain the weight back. Other than that, and you have to take your nutritional supplement, like as I told, multivitamin and calcium, and nothing much is affected on the work front. You are capable of doing most of your physical activity as a normal individual. So pre-operative assessment involves evaluation of the diseases that cause obesity. There are few diseases, few drugs that can cause obesity. You have to evaluate people for the factor that they become obese. You have to understand the lifestyle requirement of a person who is gain weight. If you can correct some modifiable lifestyle factor, then you should correct that lifestyle factor. Then you have to put that patient on a lifestyle modification program for at least 2 to 3 months before surgery, so that they are more accustomed, more trained to lose weight and comply with the surgical requirement post operatively. And after surgery, uh, patient before surgery, patient has to undergo evaluation for heart health, lung health, and other metabolic profile, so that we can correct if they have diabetes, we can correct their sugar level. If they have hypertension, we can correct their bring their blood pressure in normal range by medical treatment. Once patient is optimized, then for 15 days to 6 weeks, patient is put on special diet. After that, patient is admitted and stay in the hospital for 2 to 3 days, where patient undergoes surgery and recovery. Generally, patients are discharged on second or third day of the surgery. After the surgery, patient is on liquid diet for 15 days and then soft diet for another month. And after 6 weeks of surgery, patient can eat their normal food as a normal individual and start exercising like normal walk to start with, and eventually they can start gymming and yoga and other exercises. So recovery after surgery, generally patient is admitted for 2 or 3 days in a hospital. Most of the patient are comfortable walking around and doing their household work, climbing stairs on fifth day of surgery. And most of the patients are comfortable to join back to their professional life on seventh day, and they can start taking small walks, and then regular their exercise routine like morning walks and other thing can be started after 15 days. And maybe after 6 weeks, most of the patient can resume their workout regime and other things. So as I told, lifestyle changes and dietary modification are key for any weight loss program, be it a medical, surgical, or endoscopic or whatever. or you want to do it by diet and exercise. The important about lifestyle modification is to eat at a small frequent interval is most scientific and most healthy thing to do. If you increase your protein content in your diet to 30 to 40%, reduce your carbohydrate intake to 45 to 55%, and rest of the diet by fat, that is the most optimized level of macronutrient that you should take. You should increase the fiber content in your diet. That helps you to have satiety, and as well as improve your gut health and gut movement. A small important factor is your bacteria in your gut. That you have to take prebiotic, that is very helpful in losing weight. And for the exercise and other thing, as I said, 30 to 45 minutes of moderate workout 5 days a week is more than good enough for most of the people. So it's an important question that people ask: at what age people can undergo bariatric surgery or weight loss surgery? So there is no age criteria where we cannot operate a patient for bariatric surgery. There have been incident reported, and there have been scientific studies where children as small as 12-year old and elder as high as 70 to 80-year old have undergone bariatric surgery safely. It, of course, if a person is less than 18 year and more than 60 year, it requires special consideration and special evaluation. But there is no as such age contraindication for weight loss surgery. It all depends on your medical condition and weight. So there are multiple types of surgeries, like as I said, restrictive surgery, malabsorptive surgery. So we have good enough data about three or four surgeries, and there are few emerging surgeries where still the data is emerging. The most old and tested surgery is Roux-en-Y gastric bypass that is done laparoscopically. It is considered safe and gold standard in bariatric surgery. The second evolving surgery was sleeve gastrectomy. It is as safe as Roux-en-Y gastric bypass with equivalent good result. A little less metabolically beneficial, but still it has a also has a very significantly good metabolic advantage. Then we have one anastomosis gastric bypass or mini gastric bypass, which is very popular since a decade now, and we have enough safety data for this surgery as well. Then we have now emerging surgeries like SADI-S, SADI-I, which are very severe malabsorptive surgeries with a promising result, but data is emerging about their safety. But from initial data, it looks it is very good, and potential surgery can be done with caution. So it is a lot of people come with the question of whether we remove fat during weight loss surgery. So there is a one surgery called liposuction where the fat is liquefied and sucked into by a suction apparatus. That is a cosmetic surgery done by plastic surgeons. Most of the time, it is for aesthetic purpose, especially opted by models or actresses or actors to reduce the isolated foci of fat in particular part of the body, not as a generalized body or generalized weight loss program. Nowadays, liposuction is only done for aesthetic purpose. For doing it for weight loss is not recommended anymore. We have more metabolic and better bariatric weight loss surgery in the form of bariatric surgery that should be done if you are opting for a generalized fat loss and weight loss program. So weight loss surgeries are more recommended into that, and in that bariatric surgery we don't remove any kind of fat in your body. We just alter the absorption of the food and the quantity of food that you can eat, and you lose weight over the period of 6 months to 2 years. And the side effects of the surgeries, the side effects is defined as any effect that positive or negative that comes after an intended treatment plans. So the weight loss surgery primary intention is to lose weight. The side effects are improvement of diabetes, improvement of hypertension, reduction of the cancer risk, improvement of your osteoarthritis, and a lot of positive side effects. Yes, of course, nutritional deficiency, if you are not taking your vitamins and supplementation regularly, if you are taking less protein, then that can become a side effect. So hair loss is a very common thing that happens when you are losing weight by whatever means. Where if you lose it with diet, exercise, you do it with medicine, you do it with endoscopy or with surgery. When you lose sudden weight, then there is a definitely hair loss happens, and it's a natural to happen that, but it is a temporary and reversible. As your weight stabilizes, your hair loss reduces, and your hair fall almost become as normal individual. And if you take your supplementation regularly, there is no problem with the hairs. So when it comes to the weight loss program, it has to be a lifetime program. It cannot happen that you are eyeing for weight loss and you opt for a short-term support and short-term program. At our center at KIMS-Kingsway Hospital, we have a well-planned program, which is lifestyle modification program by the name of KingFitter. It is a team effort by qualified dietitian, qualified physiotherapist, qualified psychologist, and a physician who monitors your medical condition, who prescribe you diet and exercise, who monitor how you do it without you perform exercise without injury under a monitored care. We not only just prescribe you, we make you learn it by doing, and helps you to be compliant and take care of your mental health with the help of psychologists. And this program is available for the subscription for 3 months, 6 months, and annual. And the intensity of program can also be altered from daily, weekly to monthly basis depending on the need of the patient. Other than this, we have free monthly workshops at our places where we te- help people to understand how to do right workout, how to curate their diet, how to take care of their mental health. In addition to that, we also conduct patient support group meet every alternate month on the fourth Saturday, where patient meet each other, develops a community, helps each other, bring their innovative idea on table, and benefit all. So a lot of people do weight loss surgery for the infertility because the increase in the weight or obesity is the primary risk factor for infertility. A lot of people are referred to bariatric clinic for the infertility. Once people become normal weight and lose their excessive weight, they are better fertile after the procedure. So it increases your infertility or virility, and you can conceive and become pregnant after bariatric surgery without any additional, without any other additional intervention. Thank you all. It was very good to have interact with you and share the information about bariatric surgery and weight loss option. Feel free to ask me anything in this chat, and we will be happy to answer all your queries in future as well. Be connected. Thank you.